Hi, my name is Jason Salemi. I'm an associate professor of epidemiology at the University of South Florida College of Public Health. And I just wanted to take a moment to update everyone on Florida's progress with COVID-19 vaccines and just to use some of the visualizations that I compile from my dashboard to underscore just a few of the reasons why it's so important for us to break down all barriers to people getting vaccinated and do so as quickly as possible. So, first of all, we've got some pretty impressive numbers in terms of Florida's progress to date. Over 14 million doses administered to residents of the state. Nearly 9 million people with at least one dose of one of the three major COVID-19 vaccines. Over 6 million people have now been fully vaccinated in the state, but there's over 9 million people that have yet to receive one dose among those who are of vaccine eligible age. Here's just a simple schematic that shows how we've progressed in terms of getting at least one dose into people's arms by age group. And you can see, we started off with the elderly in the state, and we had pretty pronounced growth. And we're at over 4 in 5 seniors in the state that have now been vaccinated. You can even see for some of the younger age groups that as soon as those age groups became eligible in Florida to get vaccinated, we saw an immediate uptick in the vaccination rates, but of late, we've started to see some plateauing of almost every age group, and particularly, even though we've got 1 in 5 seniors in the state that is yet to be vaccinated, that's nearly 1 million of our elderly, they are not coming out and getting vaccinated in nearly the numbers that they were early on. Another way of looking at this is to also consider not only those who have received at least their first shot of the COVID-19 vaccine, but also those that have now been fully vaccinated. And I would just draw your attention on the fact that even among our senior population, there's a significant proportion of those seniors who have only received one dose of the vaccine and have not been fully vaccinated. And this is just for the oldest six age groups. This is showing county level variation. The numbers inside each of the counties are the percentage of the population that is yet to be vaccinated. And so you can see, especially for some of our younger age groups, whereas in some of the counties, for example, in the 35 to 44-year-old age group, we're at nearly half of that age group that has been vaccinated with at least one dose. We have some counties in which 9 in 10 people have yet to receive at least one dose of the vaccine. And so, how is Florida doing nationally? Well, if you consider the percentage of the population with at least one dose, we're at 41.1%, and that ranks 29th in the nation. Of course, we started with our senior population, so if we just focused on the percentage of people 65 or older with at least one dose, I mentioned earlier on, we're at more than 4 in 5 seniors, 83.6%, but that's still 21st in the country. What concerns me even more is if you focus on the percentage that have been fully vaccinated, our ranking drops even more, which suggests that we're not doing as good of a job as maybe we could in terms of making sure people come out and get that second dose of the vaccine if they took a Pfizer or Moderna dose. And so, why is this so important? Let's first briefly talk about the impact of the vaccine on cases. I think the most obvious is what's happened in long term care facilities. You can see that back in August of last year, we had nearly 6,000 cases in both residents and staff. And just about the time that we were starting to administer the vaccine in long term care facilities at pretty substantial rates, that's when we were coming out of our winter surge. And so you can see the number of cases in both residents and staff were at or above 3,000. And look at the impact of the vaccine. We've now got just over 300 current cases in long term care facilities in both residents and staff. And so that's huge. Obviously, if we're preventing these people from getting infected, we're certainly preventing more negative outcomes among this high risk group. This is a little bit of a busy slide, but I think it shows something very important. So the deep black line is just our typical epidemic curve, the number of cases per day. You can see the summer surge from last year and then the winter surge. What the red and orange lines are showing is the cases in the red is 65 and older, so just cases among our senior population. And then the orange line is cases among those individuals less than 18 years of age. And what you can see is for the first time, largely because of the vaccines, you see the cases among seniors dip below the cases in the pediatric population. And the most important thing of this entire graph is this area curve in the background that's shaded in gray. What this represents is the percent of daily cases that is occurring among seniors. And so early on last year, you can see that most cases, mainly because testing was not very widespread, we were finding that most cases were happening in seniors, or at least a high percentage of cases were happening in seniors. And look, it stayed pretty steady at about 16 to 17%, all the way until we started to have widespread use of vaccines in the senior population. And look at that percentage, how it's fallen to now about 7%. So now only 7% of daily cases are in our senior population. Another way of looking at this is to look at the age distribution of cases over time. And again, it's saying the same thing that I just showed you, is if you look at these two that are shaded in the deepest red or orange colors, that's our 65 and older population. And you can see how we've gone over time. This is where vaccines were really started to be implemented in this group. You can see that the proportion of cases in the senior population and just in older people in general has been decreasing over time. But it's obviously not just cases. What about the impact on hospitalizations? This is information based on a report that comes from the Department of Health and Human Services, and this is new admissions for COVID 19. And this report has been in existence since the end of February. And so, what you can see is early on at the end of February, what you basically found is that about 41% of new admissions to the hospital for COVID 19 were among people aged 70 or older. That's, of course, a very high risk group for severe illness and mortality. And so, what we've seen now over time, especially during the era in which we've been administering these vaccines at a more widespread rate, is that we've gone from 41% of all new admissions being in those 70 or older to now less than 30% being in those new admissions among those 70 or older. So we've shifted the age distribution of people that are currently hospitalized to younger age groups. And why that's important is, of course, that should lead to less mortality. And so, just a couple of slides on this again, focusing on long term care facilities that we focused our vaccination efforts on early. To orient you to this, these are reported deaths over time among everybody. That's the deep gray line. The red line is reported deaths in long term care facilities. And so, again, just like with a previous figure, what's really important is the area curve in the backdrop. What this is showing is the proportion of all daily reported deaths that are occurring in long term care facilities. Again, early on in the pandemic, we were seeing 3 in every 4 deaths reported on a given day were happening in long term care facilities. And whereas we stayed pretty static or just a subtle decline, more recently we've seen a pronounced drop where now anywhere between 11 and 20% of all reported deaths on a given day are occurring in long term care facilities. So, again, this is a relatively good sign. Another thing that I've tracked since the beginning of the pandemic, or at least since hospitalization data was reported, is one of the things that was immensely predictive of actual deaths that were going to occur is current hospitalizations. And so that's the red line here. People currently hospitalized with COVID 19. The 3 grayish bars are deaths that actually occurred 5 to 7 days later. And so all you need to notice is that the shape of these curves are almost identical throughout the entire pandemic, at least since hospitalization data were being reported in early July of last year. But you can now start to see a separation of these lines, wherein the same number of hospitalizations is now predictive of fewer deaths. And this is in large part due to the fact that the most vulnerable people to mortality, a significant percentage of them, are now fully vaccinated. Another way of looking at this is a factor that I used to track, and we would be able to multiply the current hospitalizations by this factor to get the estimated number of deaths. And so, what we can see is that this factor more recently during the vaccine era has dipped down quite dramatically. And to put this in numbers that make sense, right now we're at about 3,000 current COVID 19 hospitalizations. And so, earlier on in the pandemic, prior to vaccines rolling out, what that would have meant is it would have translated into about 88 deaths per day in the following week. Now, what that means because of the vaccines is that same number of hospitalizations, because we've shifted the age distribution to younger ages, is only predictive of about 58 deaths per day. Obviously, no deaths are good, but the fact that the same number of hospitalizations are resulting in fewer deaths is certainly something that the vaccines are wholly responsible for, and why we should continue to encourage people to go and get vaccinated. I obviously haven't even touched on the impact of the vaccines on the ability to curb spread of the virus, especially as we've got more transmissible variants out there. But again, please, if you're visiting my dashboard, that's why I emphasize, I've now been fully vaccinated myself. I encourage everybody to go out there and get vaccinated. And these are just a few visualizations that underscore the importance of our progress on vaccines and how it can make a difference in cases among vulnerable age groups, in current hospitalizations, and of course, in mortality. So thank you for your time, and I'll talk to you soon.